Salutations, respected viewers. In this video, I'm going to ask whether healthcare is a right. It's a contentious issue in the United States, not so much in other countries. Most other Western countries largely view it as a right, even if it's not actually in law. But I suppose I need to go one step back in the reasoning and inquire what a right is. Well, in some countries rights are there in law. Now, a right could be said to exist on a philosophical plane just by some process of reasoning, arriving at the notion that such a thing is a right, as in people are entitled to this, even if it doesn't have force of law. Or is a right simply an opinion of what you think people should have? Now, a right could be all three of these things, only two of those things, or perhaps just one of them. In what sense am I using a right? Well, largely legal. I do have opinions about what people ought to have. They might recognise that some things that I would like people to have, they don't have by law. Or indeed, I might recognise that certain things which are there in law that I think shouldn't be. And we could go on, like, let me see, well, I don't know if it's a right in law actually, but people saying, well, I have a right to a safe space, as in not to have to hear opinions that I find unpalatable. Well, there is a good case to be made that that healthcare is a right on a legal basis. You look at the Universal Declaration of Human Rights, drawn up in 1948, and the United States was instrumental in writing it. And it does say that there is a right to healthcare in that. And there are numerous other human rights instruments which say more or less the same thing. Now, is that actually legally binding? Again, that is debatable. That there are those who say it's not. It's simply aspirational and things like that. So I could possibly quote you the relevant section of the Universal Declaration of Human Rights, if I can find the things. So like there's this right to life, and obviously you can't be alive in many circumstances if you don't have health care. So that's that. I mean, it's not something new and not something terribly controversial, you might think. And there are various other human rights instruments which say more or less the same thing. The International Convention on Economic, Social and Cultural Rights. There are various regional human rights instruments for the different continents, for the American continent, everyone from America to Argentina, or the African continent, and so forth, which which say the same thing. So we shouldn't be arguing about this so much. Now, going on a bit further, so it was signed by the United States, ratified by the United States, so I think people in the United States ought to accept what their government agreed to 70 years ago. Otherwise, obviously the United States can't be trusted, and no other country signed up to it, and many other countries have not put it into practice, particularly those who couldn't afford to, the very underdeveloped countries. Another way to put it is this something we can afford not to do? I mean, what could be a higher priority than keeping your people alive? Now, obviously, we can't oblige people to stay alive. We can't guarantee they're never going to die. That would be preposterous. But insofar as possible, help them stay alive. Now, I agree with a wide degree of personal autonomy, and saying that people ought to be allowed to make unwise decisions and lead unhealthy lifestyles through lack of exercise, through eating junk food, through smoking, through alcohol abuse, even through drug abuse and things like that. So that might seem to militate against it a little bit, but that's not an issue of health care. And obviously the health care will be less effectual if people are leading these very unhealthy lifestyles. So that is that's probably the part of the legal basis for saying that that health care is a right. Like Article 25 of the Universal Declaration of Human Rights reads, everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food. That's the right to food. Clothing, housing, and medical care. And necessary social services. The right to security in the event of unemployment, sickness. It goes on, skipping a bit. Motherhood and childhood are entitled to special care and assistance. All right, so cease it there. And incidentally, it says the same about higher education, that progressively any fees paid for tertiary education ought to be abolished. So there it is in black and white. And what could be more authoritative? And obviously, if the United States government doesn't agree to this, don't sign it, and Congress don't ratify it. But I suppose very few people are even aware of this sort of thing. Okay, so to go further my argument, now Mr. Benjamin Shapiro is not my cup of tea, but I watch his videos quite a lot. I do concur with him on some things about how the safe space mania is pernicious and that white privilege is largely bogus and things like that. I share his distaste for abortion. I'm not a socialist. I think he goes too far in shilling for the more rapacious forms of capitalism. But he argued that healthcare is a commodity and not a right. So commodity is a good or a service that people purchase. And he talked about his spouse, who is a doctor. Saying, you can't put a gun to her head and demand that she treat you. Well, who ever mentioned guns? I mean, when has this ever happened? And he's a man who says that he is strictly rational, get rid of this wild sentimentality, and here he is emoting, coming up with this visually arresting image, which of course will beguile some people. So as he's an attorney, as he likes to remind people, he would know that something can be both a right and a commodity. Take legal representation. Supposing somebody is charged with a felony, perhaps even a misdemeanor. Now, he or she is entitled to hire an attorney, but if this person can't afford one, then the court will provide one. So that's it. So the right to a lawyer is a right, and it's also a commodity. So these things are not mutually exclusive. It's a false dichotomy he's offering us. So don't fall for this notion that it's a binary choice. Now, it wasn't always so. If you go back a couple of centuries, those who couldn't afford lawyers, they just didn't get them. So I suggest that we have moved forward, and we need healthcare rather more than we do legal representation. Anyway, who has ever suggested threatening a physician with a firearm for the sake of healthcare? Now, Mr. Ben Shapiro is an outspoken and vehement opponent of gun control. So he'd like guns everywhere in the hands of just about everybody, including assault rifles. Take him into hospital, why not? Wouldn't that be an outrageous breach of your Second Amendment rights if a person wasn't allowed to bring an assault rifle into the emergency room? He doesn't want them in there. If not, why not? What if someone were to try and shoot me in the emergency room? Anyway, where was I about this? Whatever happened to the Hippocratic duty? You may know Hippocrates, this doctor in ancient Greece, who said that we ought that physicians ought to treat patients, do what is best for patients, and act in a disinterested manner. That obviously means not seeking personal gain so much, trying to achieve the best outcome for the patient whilst respecting the patient's wishes and not treating them, if they're an adult of sound mind, in a non-emergency situation, not treating them against their will. So surely doctors who have a Hippocratic obligation to do this. Now, I'll make a point against myself. There is a certain lacuna in what I say, is in that things have moved on, in that the Hippocratic Oath says that abortion is impermissible. And nowadays, most physicians would say that it is acceptable, even an elective one, not when it's medically necessary to save the woman's life. So why are people in medicine full stop? I would hope it's not sheer avarice. They're primarily actuated by wishing to help their patients. It is a privilege to heal, and that's why they do it. My father met two Harvard-educated pediatricians in Tanzania, saying these men could be making $500,000 a year in the United States, and inquiring of them, why is it that you're here earning an absolute pittance? And one of them said, in the United States, I mostly treated children who were only slightly ill. But here, I save lives every single day. And obviously, that he found deeply satisfying. That's really why he became a doctor. Okay, so we shall go on. So doctors are sometimes very badly paid, like, Romania and Russia, places. They're paid often the equivalent of, say, $700 a month. And there are loads of them. Are they as high quality as in the United States? I don't know. Possibly not. But people are not solely actuated by money. Romania, bizarrely, seems to be almost a working class job, being a medical doctor. Whereas the United States, I think I'm right in saying, they are the best paid in the world. which doesn't necessarily mean that they're better. Maybe they are, but often there's defensive medicine doing things for a legal rationale rather than a medical rationale, over medicating things, which would make the situation worse in some cases. Okay, so there's another human rights instrument which makes the same point about healthcare. The International Covenant on Economic, Social and Cultural Rights. Again, the United States is a signatory to this, and again, it's been ratified by the U.S. Congress. Here's Article 12. The state parties to the present covenant recognize the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. So the steps to be taken by the state parties to the present covenant to achieve the full realization of this right shall include those necessary for the provision for the reduction of stillbirth rate and of infant mortality, and for the healthy development of children, the improvement of all aspects of environmental and industrial hygiene, the prevention, treatment, and control of epidemic, endemic, occupational, and other diseases, the creation of conditions that would assure to all medical services and medical attention in the event of sickness. So I close the quotation there. So some people can't afford health insurance. Sometimes the health insurance includes most treatments and medicines, will cover any condition except for illness. So the US government has taken onto itself the obligation to therefore provide those medical services to those who can't afford them. This was signed up to in 1966. Yeah, you particularly got to provide for children, for pregnant women, as it emphasizes. Epidemic and endemic control, because health is a public issue. It's not just a private issue. There are many communicable diseases. I could catch a disease from somebody else. I could transmit it to somebody else. That's why the government does need to be involved. It's not solely about individuals. No man is an island entire of himself, especially when it comes to healthcare. Right, there are a few other human rights instruments I could read out to you, but I shan't bore you with that. Now, which country has got the best healthcare in the world, according to several academic studies? It's France. I know some people scoff at the very name of France, but I hold it in very high regard. French doctors are paid roughly a quarter of what doctors are paid in the United States, and they still have the best healthcare in the world. One of the highest life expectancies, despite a relatively high rate of tobacco and alcohol consumption, and indeed what's the other unhealthy lifestyle? Well, eating fatty food. Partly because they've got lots of free time and they lots of time to exercise, things like that. So there's got to be something going there. They have a sort of social insurance scheme, pay for it through your work, and often you have to pay up front for your healthcare and then claim it back. But, it seems to work really well. So France has got its problems and higher youth unemployment. I acknowledge all that. But would I accept that in return for superb healthcare? Yes, I would. I remember when I was working in France, speaking to a woman who worked in the supermarket. There she was. She had a one-bedroom flat and a car, and she only had to work 35 hours a week. And she could afford to dine out, go on holiday occasionally, buy an elegant garment now and again. And so despite doing a low-paid job, she had an admirable standard of living. If she's in the United States, she'd be working 60 hours a week and still not pay the medical bills. Now, which is better for the average person? There's no question in my mind that the French have got it right. Now, emergency care in the United States is free of charge. The ambulance come and get you, treat you, the hospital has to stabilise you, then discharge you. So you don't have to pay for that. Why not? If it is a commodity, why not charge them? Why don't feel for the credit card in their pocket? Say, forget it, no, not right. Or indeed, bill them afterwards. Now you might say, oh, come on, emergency situations are different. And I accept that sometimes in an exigent moment, we have to disregard the ordinary rules. But how urgent does it have to be before it counts as an emergency? Imminent death, like within a minute, within an hour, a day, a week, a month, what? There's some cut-off. So I know this gets into the absolutist fallacy, that because we can't be crystal clear where the cut-off is, doesn't mean there's no distinction to be drawn as well. So if these treaties are ratified, surely they are part of law. Now, I know some countries are dualist countries, and just ratifying a treaty does not in itself make it legally binding. But there is such a thing as international law, which is adjudicated by various courts, like the International Court of Justice and so forth, and the International Criminal Court. So these have some legal effect, and they ought to have some domestic effect as well. So on a legal plane, I'm arguing that these things are rights. Moreover, it is my opinion that people ought to have these things. And you see what Big Pharma would do, would try and persuade people to get treatments they don't need, to over-medicalize things. Then because doctors are thinking that the patients are customers, customer is king, got to give them what they want, give them medicine they don't need, give them the medicine, give them when they don't need any, sometimes give them the wrong medicine because they demanded it. Well, what do I know? Someone like me, I gave up chemistry and biology when I was 15. I can't even pronounce the name of the condition I've got. So how should I choose? An uninformed choice is no choice at all. And because of my lack of comprehension of the finer points of pharmaceuticals, in effect, I don't have knowledge of these things. And so people are requesting medicines on the basis of advertisements they've seen on television, which only last a minute, and they're choosing because the actors deliver their line with panache, because they were good looking, because of the background music, all these sort of matters of style and not of substance, nothing to do with the actual biochemistry of the medicine, and checking things out too much. And obviously, the first law of medicine is to do no harm. And over-medicating can actually harm the person more, make these drugs less effective in the long run. Why people are hooked on prescription drugs, why America was becoming Prozac nation in the 90s. People dispirited, well, why do they supposedly have depression? They reported these symptoms sometimes because they really had depression, but more often because they were stressed out, they're working long hours, they couldn't afford the drugs they were then addicted to, and on and on. There was no more job security, jobs for life were long gone. And so medicalizing a problem which had more roots in political and economic choices than actual health. So there we have it. Healthcare is a right.